Get started. Welcome to Keep Calm and Learn About Diabetes. This month is Diabetes Awareness Month, and we are really excited to have an awesome guest speaker with us today. We have Dr. Ashe from Care First. She recently joined last year as a medical director. She has been in internal medicine for 14 years and is extremely knowledgeable about all things diabetes. So we are going to turn it over to Dr. Ashe, and you have the floor.
Good afternoon and happy Wednesday. I'm so excited to talk to you all today about diabetes. I'm just going to jump right into the next slide. So we're going to talk basically what is diabetes, how do you recognize it, the signs and symptoms, how do you prevent it? If you are diabetic, what are some treatment and management options? And then we'll end with just resources from Care First and how we can support you all. So before we get fully started, the first question I have for all of you is, do you know someone with diabetes, or have you lived with someone with diabetes? Have you worked with someone with diabetes? Wow, you guys are all answering.
Can you see the results on the screen?
I can.
Okay.
So I am going to end it. Yes. And it looks like at least 30% of you even have diabetes. Half of you have a family member. Another fifth of you, 21%, have a friend or a coworker. Some of you, even your spouse or your partner. Very few don't know anyone. So this is just showing how much it affects all of us and the people we live with, the people we love, the people we work with. So what is diabetes? It's basically a group of diseases that result in too much blood sugar. So you have too much sugar in the blood. And how does that happen? Well, it can happen if your pancreas, which is our organ that helps manage our digestive system, it doesn't make enough insulin, which is the hormone that regulates calories and sugars, or if you have insulin but your body doesn't properly respond to what insulin is telling it should be doing. So basically the pancreas makes the insulin, it either doesn't have enough, or you have the insulin and it's not doing, the body isn't responding to it appropriately. And so if you think of it as a debit and a credit, insulin's job is to help you either spend or save. And if you think of a marriage and a healthy marriage or a healthy budget, let's say that, you have some spending and you have some saving. When your body isn't responding properly enough, it's like a stingy spouse. I won't say stingy husband. My husband gets upset. That's holding on to those calories or holding on and saving too much when it should be spending. And as a result, it makes it difficult to lose weight. And at the end result, you start to store these calories that you should be burning and your blood sugar goes up. So we talked about either not having insulin versus having insulin. And that's where these different types of diabetes come into play. So you've heard of type 1, that's when your pancreas doesn't make the insulin. And what happens is it's an autoimmune disorder. And so your immune systems attack and inappropriately destroy the cells, the beta cells that make the insulin in the pancreas. And as a result, you don't have insulin. And so your sugar goes up. Type 2, which is the most common type of diabetes, is when your body does not use the insulin properly. So your pancreas tries to make more insulin, but it can't keep up and it's not properly responding to that insulin you have, and it's stingily holding on to those calories, and so you get high blood sugars. And then there's also a third type, gestational diabetes. This happens during pregnancy. The cause is not quite clear, but it's thought to be related to hormones that the placenta makes that can affect how the insulin works. So these are your three main types. The most common by far is type 2, but you'll hear of type 1, type 2, and gestational diabetes. Now, what is pre-diabetes? Something that your doctor should have discussed with you or your provider, and it's basically a warning. And we like to say, don't let the pre fool you, because you definitely still have risk factors with pre-diabetes, but it is a good time if this is you to say, what can I do to prevent having diabetes? What changes can I make? So people with prediabetes have higher blood sugars than normal, but not yet enough to be considered diabetic. It does put you at a risk of still having heart disease or stroke, and then obviously turning into type 2 diabetes. What's interesting and alarming is that almost 100 million people in the US, so 97.6 million, are in this category where they have prediabetes. Over and that's 1 in 3 in the US. And so if you think of prediabetes, it's a good way to say, this is a warning, let's prevent it. So how many people, we said almost 100 million people in the US have prediabetes. So about 38.4 million Americans have diabetes. 95% of them have type 2 diabetes. On average, 1.2 million Americans are diagnosed each year. If you kind of look at the numbers, 30% of those that of age 65 or more have diabetes. And this is interesting. If you are pre-diabetic, 70% will go on to develop diabetes if there are no interventions. And we can talk a little bit more about what those interventions should be. Next slide. So what are the risk factors? So obviously a family history is a risk factor and an indicator that you might be at risk for diabetes. It tends to be older adults, 35 or older. However, recently we've seen a lot of children and teenagers also developing type 2 diabetes in later years, but the risk does increase as you get older. If you are overweight or you are considered obese, you have an increased risk factor. If you have a sedentary lifestyle, so you don't exercise, you don't move around a lot, you're at an increased risk for becoming diabetic. If you have high blood pressure, and then also race does play a factor. We've noticed that American Indians, African Americans, the Asian Americans, and Hispanic, Latino, and Pacific Islanders all have increased risk for becoming diabetic. So let's go back to weight. So BMI as well as weight circumference are tools that we use to determine if you're at a healthy weight or you're overweight. Full disclosure, BMI is not the best. It is just what we have and the most useful. And we try to do the best with what we have. And I say it's not the best because it does not take into account protein. So let's think of Simone Biles. We all love Simone Biles. Her BMI might be a little bit higher for her age, but we know that she's not overweight. She's just solid because she's a gymnastic. She's an Olympian. Same thing with LeBron James. He's solid. And so his BMI might be higher. And so people like that, it's really not as accurate. But this is what we have, and it's something we can kind of track over time. It's very easy to figure out what your BMI is. It's simply use your weight and your height, and there's a calculator. And so if you're 25 or higher, BMI of 25 or higher, you're overweight. However, factoring in race and effects of genetics, if you're Asian American, 3 or higher, you're considered to be overweight. But Pacific Islanders might be overweight if their BMI is 26 or more. So in recent years, we have tried to adjust for other factors. Another good thing to look at is waist circumference. So men who have a waist circumference more than 40 inches, women who are not pregnant that have more than 35 inches, they are at likely higher risk for being obese and for becoming diabetic. So it does line up. People who are obese are almost 20 times more likely to become diabetic than people who are not obese. But it's, again, we do the best we can with the tools we have to decide whether or not you're obese. Signs and symptoms of diabetes. So, the two most common is you want to drink a lot of water and you wanted to go to the bathroom very often. Those are very, very common symptoms of undiagnosed diabetes. You feel very thirsty and you urinate often. Other signs and symptoms are you're very hungry, even though you're currently eating or you just ate. You feel like you can't get enough. You could have blurry vision. That's a sign that your sugar is extremely high. You could feel fatigue. Other signs and symptoms are bruises or cuts that won't heal. And the reason being, or easily get infected, recurrent infected cuts or bruises, because they're open, the sugar is high, it's kind of coating the nerves, it's coating the cells that would be healing. And so they're slow to heal. And then bacteria love sugar, so you're more likely to get infected if your sugar is higher. You can also, you see weight gain often, but sometimes you can see weight loss, even though you're eating more, and that's often seen more with type 1 diabetes rather than type 2. And then in type 2, again, when we talk about the sugar kind of coating the nerves, you can get tingling or pain or numbness because that extra sugar is affecting your nervous system. So these are the most common signs and symptoms of diabetes. All right. How often should you get tested for diabetes? This is just a quick knowledge test. Okay, and it looks like most of you have just about answered. So we have every 3 months, 23%, every 5 months, 5%, every year, 67%, every 3 years, 5%, once in a lifetime, 1%. And then I see the yearly. So it's going to depend on your age and risk factors. That is going to be the short answer. But every year is a good thing to think about. And then if you've had elevated tests and you're in that pre-diabetic range or you're diabetic, then they may want to do testing more often, and you might do A1C, which we're going to talk about in a few moments, every 3 months. So depending on your age and your risk factors, most likely it will be every year, but it could also be every 3 months. All right, so how do we test? So the most common and the quickest is just going to be pricking your finger and checking your blood sugar, or taking a blood test and checking your blood sugar. And we can do that in a few ways. So we can test it if you're fasting. So you haven't had anything to eat for about 8 hours, so overnight. And we look to see what that number is. A random blood sugar, just, hey, you're having these symptoms, you're in the office, we check it. An A1C test is tends to be a good test to do because it gives the average blood sugar over the past 3 months. Why does it do that? So it's hemoglobin A1C, and so it tests what the average blood sugar is on your hemoglobin. So on your red blood cell, hemoglobin is on your red blood cell, and those red blood cells live for about 90 days. So that's why it's good for about 3 months, and it tells you what the average blood sugar is. And that is better than one picture in time. So if I check your blood sugar today, right now, it may not line up with what it always is, but if we check the A1C, then that gives us a good picture of what it looked like for the past 3 months. And then glucose tolerance test is a little bit more involved. It measures your blood sugar before and after giving you basically a glucose liquid, and they kind of challenge you to see how fast your body can process the sugar and what they are. That is done more likely in with gestational diabetes. More often, if you're not pregnant, they can do it that way, but if you're not pregnant, they're going to want to follow an A1C, and they will have you sometimes at home, if you are diabetic, check your blood sugars and kind of monitor those. So what should those numbers be? So we talked about the blood sugar. So if you are fasting, a normal blood sugar should be below 100. If you are fasting, meaning you haven't eaten in 8 hours, and we check your blood sugar and it's between 100 and 125, that is likely pre-diabetes. You are not diabetic, but you are at risk for becoming diabetic. And then if it's 126 or above, you're fasting, it's likely diabetes. So these are the numbers for just the regular blood sugar. What else do they correlate with? A1C. If your A1C is less than 5.7, then it's likely normal. If it is 5.7 to 6.4, then you are in that pre-diabetic range. It's higher than that 100 to 125. So 5.7 to 6.4, pre-diabetes or at risk for becoming diabetic. And then diabetes, if your A1C is 6.5 and above, we consider that diabetic. These numbers have changed from prior years. That number A1C was 7 before. They have done more research and more study, and it has become a little bit tighter. I did see that comment, so yes. How do you prevent diabetes? So even if your numbers are abnormal now, or your family members have it, you have the power to change things. So your numbers can return to normal. And so this is the good news that I want to leave with you today. Even if you're diabetic, especially if you're pre-diabetic, you do not have to stay that way. And so how do we recommend changing? So first, you definitely want to make sure you get screened if you haven't, to see where you are and just know your numbers. But also, if you other things that will help if they are high to return would be increasing daily physical activity. I recommend walking. You could do yoga. There are lots of different things you can do, and that kind of helps. That's good for lots of reasons. Increase physical activity, not just blood sugar, but it will help to burn excess calories and to help manage your blood sugar. If you are overweight, we found that losing just 10 to 15 pounds can make a huge difference. And so you don't have to shoot for 60, 70 pounds. Small gains, small goals can make a huge difference. And I talk about that with physical activity. There was a study that shows if you walk 14 minutes a day, most days a week, you can decrease your cardiovascular, meaning your risk of having a heart attack or stroke, almost by 15%. And so again, small differences, small changes go a long way. You can also look at what you eat. You can make small changes to that as far as, your carbohydrates, your protein intake, other things that affect your weight and your blood sugar, stress, and sleep. because if you're not getting enough sleep or you're stressed, you are more likely to be overweight or to be obese, and you are more likely to have difficulty controlling your blood sugar. So it's more holistic. So you want to move your body, you want to be mindful of what you eat, you want to make sure you get some sleep. Meditation is also good to help manage that stress. Next slide. So let's go a little bit more into it. Why does physical activity help you? So as I said, it helps burn up that energy or excess calories, because calories are essentially energy. It makes that hormone insulin, there's that hormone again, work better. It reduces blood pressure. It improves your cholesterol, which is the added benefit. And also physical activity and exercise will help strengthen muscles and bones as well, and you'll feel better. It also helps manage stress, and it also helps with sleep. Next. Just a quick poll to the group. What kind of exercise do you like to do, or movement of the body, as I like to say? I see a lot of walking, a lot of running, and a good amount of yoga, strength training, water aerobics. Feel free to drop in the chat what the others are. I'm kind of interested into seeing what that is. But again, all these things, and you don't have to do the same thing all the time. You can mix it up. And swimming is a good one. Pilates is a good one. Dancing is always fun. The cycling or riding your bike, whether it be stationary or outside. Ooh, kickboxing. That's fun. I was looking for pickleball, and there it is. Tennis, golf, all these things are good. They're good for exercise. They're good for helping your blood pressure. They're good for helping stress. And so I definitely recommend. Next slide. And these are my exercise partners. Anytime I can show my fur babies, I do. The white one is Essie, and the brown one is Rocky. Essie's 5, Rocky's 1.5. They keep me very busy. And I was able to kind of change my life and lose a good amount of weight, because I got to walk them about 30 minutes to an hour per day. But these are my fur babies. So that is my plug to say, if you were thinking about getting a dog, you should definitely get it. Next slide, healthy eating and prevention. So we talked about physical activity. What you fuel your body with, or what you eat, really is going to be key. And you have, diet is one of the most powerful tools you have to help you feeling good, to control your blood sugar, and to improve your health. It is a tool, and it's your decision, and you have the power to do that. There is no one size fits all diet. And so what works for one might not work for the other. I'm not a never kind of person. So I will not say you may never have a piece of cake. That's just not how I do things. But what I will recommend is monitoring those portion sizes, eating a variety of food, space your meals evenly throughout the day, unless you are doing intermittent fasting, which also works for some people. I would tell you to avoid skipping meals, but I know that that works for some people. So you'll figure it out. And some of it is trial and error. So we know that medicine is an art and a science. And so we give the science, and then you and your provider and your family, you guys kind of help do the art part. But types of food that are good that I can recommend, obviously we talk about that. Meat substitutes are a good option, and it doesn't have to be all the time. You might decide 1 or 2 days a week you won't eat meat, or you won't eat red meat, or fatty meats. Non-fat dairy is a good idea for help controlling blood sugar. whole grains, and I guess I said fruits twice, but the whole grains are good too because they have a good amount of fiber. It's going to help you feel fuller, and it's a little bit more complex. So it takes your body a little bit more time to digest. And so the sugars will not be released quickly. And so that's good for digestion, and that's good for helping to control. Again, I would not say you can never have, but I saw a question about fruits. Obviously, probably the better the better fruits, in my opinion, have more higher glycemic or higher content. Things like pineapples, which are very good, might be a little bit more sugar content, but it doesn't mean that you can't have them. It just means that there needs to be, I saw someone put in the chat, balance. And so if you're going to have that, then what are you having with it? What are you pairing with it? What is the, again, if we think debit and credit, what does the rest of your day or the rest of your week look like, even if you're having a cookie? So I definitely recommend having 3 meals a day and 1 or 2 snacks. That seems like a lot, but very small portions and multiple times a day helps control the blood sugar, helps you feel full. And you can also definitely work with a nutrition expert as well. Next slide. So true or false? Choosing a healthy snack should offer a combination of protein, healthy fat, and fiber. Okay, so this is true, and most of you got that. And when you have fiber and you have protein, again, it helps you feel more full. So it helps to avoid overeating, and healthy fats are good for you, like avocado or olive oil. And so this is a true answer. And you want it, and I don't know if you've grown up, you've heard, your grandmother, I know my grandmother would say it should have multiple colors on the plate and try different things. And that's kind of a part of it. You want to make sure that you're mixing and matching. So this is true. Next slide. All right, so diabetes treatment and management. So, oh, okay, well, let's talk about the complications of diabetes first. And so most of them are pretty big. So heart and cardiovascular diseases, because the longer you have diabetes and the less you control your blood sugar, you get what we call metabolic syndrome. And so you're more likely to get inflammation. You're more likely to get the plaque buildup that can happen that causes heart attack or stroke. And so high blood pressure, heart attack, stroke is a big complication of diabetes. Another common, we talked about the tingling and the burning as a common side effect. So nerve damage, again, the sugar coats the nerves and affects. And so that nerve damage can happen you have a decreased sensation in the legs and in the toes. And that's how a lot of times you end up getting these multiple infections, and you can get amputations because people will step on the nail or they'll injure their toe and they didn't know. They look down and it's bleeding, and it can get infected quickly. So nerve damage is a big issue. That nerve damage can also lead in other areas of the body, affecting, erectile dysfunction. It can affect the kidneys. That sugar, again, coats some of these arteries, coats some of these nerves. The tiny blood vessels in the eye, that's why you can get eye damage. So kidney failure, amputations, nerve damage, eye damage, and then If you're have gestational diabetes, you have a lot of risk, including diabetes eventually in the child, but also preeclampsia or eclampsia risk at birth, and or excess growth, which leads to more C-sections. And so there are a lot of complications if left untreated and long-standing. Next. Okay, so how do we treat it so we don't get to the complications? So a lot of people know insulin. So people who have type 1 diabetes, absolutely, you replace the insulin. Have gestational diabetes or type 2 diabetes also may need insulin replacement. And that's probably the most common that people know about because we know, hey, you have diabetes, you give insulin. So definitely in type 1, sometimes in type 2, and often in gestational diabetes, people need insulin. Long-standing type 2 diabetes, uncontrolled type 2 diabetes, you will need insulin as well. Other medications like oral drugs, so metformin is a very common first drug prescribed. Metformin decreases appetite. It makes your insulin work a little bit better, and it helps with managing those blood sugars. So we use metformin. There are other drugs that also do similar. Glipizide is one of them, glimepiride. There's just a number of oral medications that we use. And then GLP-1s, which everyone has heard about now with the commercials. Oh, it's magic. I know we keep seeing these commercials. It is initially a diabetic drug. It does so on a hormonal level. It makes that insulin work better. It's glucagon-like peptide, so it acts and stimulates like the glucagon hormone, suppresses appetite, which is why it does also help with weight loss, but it does help with regulating blood sugar by making that insulin work better. Next slide. So that is what your provider can do. They can prescribe you medication, but what can you do aside from the medication? So again, I like to say all the things. You monitor your blood sugar, you mindful of what you eat, you move your body, and you take the medications if they're prescribed, and you want to make sure you follow up with your healthcare provider. And so you monitor your blood sugars, you be mindful of what you eat, you move your body, take your medications, and make sure you follow up. And so the doctors or the providers just have that one part. We kind of do the medication and we do education, but you really are in control of the management of the diabetes. And so there's some other things. You might also need some behavioral counseling with healthy coping and all of that, and to further reduce your risk and to help make changes. Because sometimes if you've been doing something the same way for a long time, you might need help with changes, and hopefully we can do that. But monitor, move, be mindful, eat, and take your medications. And the last M, make sure to follow up regular with your doctor or your provider. And I'm going to turn it over to Katie to talk about our resources, to say how we can further support you to manage your diabetes, to prevent your diabetes. And I appreciate all of your time today.
All right. I'll go through our Care First resources pretty quickly because we have a lot of really good questions in the chat. So if we want to go to the next slide. All right. Hopefully you're aware, but we offer Care First Wellbeing, which is a personalized digital wellness program. It provides simple, easy to use tools as well as resources that can help you address every aspect of your well-being. Our Care First Wellbeing program is completely free. It includes a real age, which is a health assessment that determines the physical age of the body versus the calendar age. A personalized health timeline feed that is constantly changing, tracking capability, challenges to keep you motivated, your own personal health profile, as well as our unwinding program. Next slide. In addition to that, we also offer specialized programs, including health coaching, weight management, tobacco cessation, financial well-being, and our Blue 365 discount program. All of these programs are, again, free. We offer 2 diabetes prevention / weight management programs. The first is Noom. Noom is a digital forward approach that helps users understand their habits at a psychological level and then offers the flexibility to engage in a self-mannered pace. We also have Eat Right Now, which focuses on mindfulness. It's a mindfulness-based program that helps reset your relationship with food and adopt new and healthy habits through live weekly group video sessions, self-paced learning, digital coaching, and more. For both Noom and Eat Right Now, you do need to qualify. The programs are free if you qualify, but you do need to qualify. Qualifications include an elevated BMI 25 or greater, a pre-diabetes diagnosis, and more. And then we have personal health coaching. So our health coaching program is also another free resource. It is one-on-one coaching with a certified health coach or registered nurse, depending on which pathway you are in. Anyone qualifies for lifestyle management. You'll work with a certified health coach or health educator on lifestyle behaviors, such as the ones listed on the slide. And if you have one of our 10 core chronic conditions, you would work with a registered nurse who can help you set goals and manage your chronic condition on a little bit more of a clinical basis. And last but not least, here are some more Care First resources for you to check out. We will send the slides, so you'll have all of this at your fingertips. And then Haley, I don't know if you want to do our questions.
Sure, yep. So we have a couple questions, Dr. Ashe, for you in the chat. I'm just going to go ahead and scroll up to the top and go down from there if that works.
Yes, that works.
And I did see a couple questions as well regarding a recording. The recording will be sent after this as well, so you guys will get a recording for this presentation. The first question looks like, just scrolling down to it, it says GLP-1 is being strongly marketed for weight loss. What impact does it have if you are not diabetic or pre-diabetic?
Sure. So it still helps with weight loss, and it typically won't overshoot. So what I mean is, if your blood sugars are normal, it will still make your insulin work better, because a lot of times when people are obese or overweight, even though their sugars are normal, they're not in a pre-diabetic range, they still have the beginnings of that insulin resistance, or that insulin, their body not being fully responsive to the insulin. And so what that looks like is, even if you're working out or you're eating right, you still can't lose weight, or you get to a certain age where your estrogen is decreasing, or your testosterone in men, and you start to notice, okay, I'm starting to gain weight and it doesn't make sense. And that very well may be related to what's going on with your insulin. And so we find that in patients who take the GLP-1s for that reason, for weight loss, that's probably why they're having a lot of success. It also decreases appetite. So diabetes or no diabetes, people are losing weight.
And then the next question is, can you reverse diabetes or not get diabetes if you are pre-diabetic?
So the first question is, I like to think of it as in remission. So you can definitely bring your numbers back to normal, but if you stop doing whatever you did to bring them back to normal, it will go back up again. And so it's more so a remission. You know, you had, like, if you have breast cancer, you get treated, you have no active evidence of cancer, but we would say you were in remission. So you can go back to normal if you're diabetic. But if you stop doing whatever was done to get back to normal, it will revert. If you keep doing it, though, however, you can stay in those good numbers, normal blood sugars, and you can help prevent a lot of the complications that I talked about. As far as the prediabetes, absolutely, you can go back to normal and stay normal again if you've made good changes and you stay in those changes. If you're gestational diabetic, you do have a risk of becoming diabetes, increased risk, but you can, you know, a lot of times after you deliver, you can and will go back to normal blood sugars.
Thanks, Dr. Ashe. And then another question that just popped up is, should a pre-diabetic person monitor their numbers with a home kit? And if so, how often should they test?
Typically, they won't have, if you're not diabetic, they won't have you monitor at home. You know, and especially if you're not on medication, it seems to be a lot. So the best thing you could do is talk that over with your provider. Probably what they're going to do is have you do nutrition changes. They might even start you on certain medications, even though you're pre-diabetic and not diabetic. And then they'll just kind of monitor your A1C every 3 months.
And then another one that just came through, I'm pulling up, heading out of the chat and now into the Q&A area. How many calories a day should you have for diet if you're diabetic, it says?
So that is gonna, the short answer is it depends. It really depends on what your current weight is and your height. It also depends on how active you are. And so someone who is not very active, they don't need as many calories. But if you are someone who runs and you're weightlifting and all that, you're going to need more calories. And so I'll give you an example. The Rock, I love The Rock, Dwayne Johnson. Sometimes he eats 5,000 or 6,000 calories a day to kind of keep up with, you know, the kind of activity that he has to do, which I think is a crazy amount, but he's a much bigger guy and he's very, very active. And so you can probably figure that out for you specifically, again, based off of your weight and your level of activity. And they can do testing. If you are diabetic or not diabetic, they can do testing just to kind of get a gauge to see what they call your basic metabolic rate. Like if you're doing nothing, how much calories does your body kind of burn? And so that is something you can look into. They will, and then depending again on your age, weight, and how active you are, a nutrition or like a registered dietitian can also make recommendations about how many specifically carbs, calories, and different things like that.
Great, thank you. And then actually one more just popped up and then we'll close out the Q&A portion. It says, for a person with diabetes, what is the glucose level goal to prevent complications?
So if you are already diabetic, we definitely try and get you usually between 130 and 150 is a good goal. Yeah.
Thank you so much, Dr. Ashe. Really appreciate it.
Awesome. Yeah, a lot of great questions. Always remember, these are conversations you can have with your primary care provider, especially if they are unique to yourself. If you need help locating or finding a primary care provider, please feel free to reach out to Care First. Want to say thank you to Dr. Ashe so much for the wonderful presentation. I loved it. I thought a lot of your analogies were really wonderful. After this, a poll will pop up, so please fill out our poll. And then next month, December 4th, we are going to do a presentation on healthy and happy holidays. So would love to see you all there. Thanks so much and have a great day.